Oh, we're live. Sorry. Sorry, it was taking a bit of a minute. Are we live? I think we're live. Right. Yes, I am completely focused and on board with the task in hand. What is that task? I hear you scream. It's answering questions in relation to plastic surgery kind of things. That's what I'm here for. That's what I'm doing. It's 7 o'clock Tuesday night, and I've been doing it for years. Started on Facebook, moved to Facebook and Instagram, and more recently added YouTube on it. For some reason, I can't do it on Instagram. I don't know why. It's just stopped working. It says something like your account's not able to use this facility or something. I don't think I've done anything wrong. Goodness knows I've done wrong things in the past. I hold my hands up. I have been banned by Facebook. I actually haven't been banned by Instagram, but I have been banned by Facebook in the past for certain photos, should we just say, that I have posted, which have deemed to be against their rules. But I don't think I've done anything recently bad on Instagram, but it feels like a random thing. Anyway, anywho, there's a very, very vibrant and lively community on YouTube and Facebook. Let's face it. Just the YouTube and Facebook community will have this room filled with my fans. So not sure where they are at this present time, but they're there. They don't actually literally have to be there. They're out there. So I know you're out there. You're out there. You may not be watching this right now, but you know that you're there. So that's what matters. So the actual watching of it is less important, really. Anyway, I'm going to carry on. True professional. So with some questions and answers, and I'll be answering these questions. I'll be asking them and answering them to myself, but that's okay. Maybe it's not working. Maybe it's not actually working on Facebook and YouTube, or maybe no one's watching. I don't know. Either way, it doesn't faze me, and it's fine. It's absolutely fine. Is having a hiatus hernia an issue to having a tummy tuck with liposuction? No, not. Well, I would say not at all, but not in the same way. Recently, I've been talking a lot about hernias and tummy tucks for some reason. But a hiatus hernia is different. A hiatus hernia is not like other sorts of hernia. A hiatus hernia is kind of internal. It's where the esophagus passes through the diaphragm and joins the stomach. And so when you swallow food, your food goes down your esophagus, your food pipe into your stomach. And a hiatus hernia is when the stomach kind of herniates or dislocates up through the diaphragm, and that makes that join between the stomach and the esophagus a bit less robust, and so you get reflux. Basically, you get heartburn, acid reflux. But it's an internal thing. It's inside your abdomen. It's not external. So it's not an external hernia like the sorts of hernias we've been talking about before with tummy tucks. It's inside your abdomen as a hernia through your diaphragm. And so we would completely not see it, and we would have completely nothing to do with it doing a tummy tuck, although the anaesthetist would probably want to know if you suffer from reflux. So it'd be more of an anaesthetic thing than a surgical thing, and it's certainly got no bearing on the surgery at all. So it's actually fine from that point of view. But as I say, the anaesthetist would want to know. There are tan spots on my scar. Will they be permanent? What measures should I take to remove them? Difficult without seeing your scar, this one. First question, always the question when you're dealing with scars, how old's the scar? So if the scar's less than a year, I'd first of all be saying that's less likely it's, there's more room for it to change. But also if it's less than a year and you've got sun on it, that's the one thing that I'm worried about. If you've got sun on it, if it's a kind of relatively fresh scar, and a year would be the sort of benchmark for that. So if it's still quite red and you got sun on it, then you can get tanning on the scar, pigmentation of the scar, which doesn't fade and can be permanent. So if it's a early scar and you've got tan on it, sun on it to tan it, then that might be permanent. If it's a later scar, if it's a sort of more mature scar, I'm not sure what they are, the tan spots. So they might be just be like pigmentation of your skin. And I would advise you don't really take any measures to remove them in your own hands, but kind of see your doctor. Don't go, messing with things. There's all sorts of things people talk about, but go and see your doctor and just see whether it's just tanning of the scar, or whether it's pigmentation of the skin, whether it's a mole that's within the scar, or it's when you're seeing tan spots. I don't know, it sounds a bit odd. So go and see your doctor or your surgeon. If I'm your surgeon, come and see me. Doesn't sound like anything to worry about, but I guess it's a cosmetic thing, really, isn't it? If you've got tan spots in your scar. Is it hard to remove a tattoo on the spine? No, not no. The spine will not have any effect on it, basically. The thing that has an effect on the tattoo is the laxity of the skin and the shape of the tattoo. Those are the things that have an effect. There is a bit of skin laxity in the spine, so if you've got a favourable, so if you've got one like going down your spine, kind of quite thin, brilliant. There's no problems if you're kind of thinking spine and spinal cord and all that sort of stuff. We don't go anywhere deep. We don't go anywhere near the bones, anywhere near the nerves. So there's no problem with removing a tattoo that's over the spine, because we're not going anywhere near the spine. We're just cutting skin out. Aside from the fact that it'll be tight, and when you bend over it might be tight, and all those kind of things. But I think this question is alluding to the fact that the spinal cord is there, but we're miles from it. So we're not worried about the spine at all, because we're just cutting a bit of skin out, really. Shouldn't make it sound so belittle it. It's clearly quite a major undertaking. Should you remove all moles if you suspect of the symptoms? Oh, that's a difficult one. I'm going to say no. I'm going to come down one way or the other. I'm going to say no. I think if you suspect symptoms, or if you have symptoms, you should get them checked out. I think that's what I would say. You for sure need to get them checked out. But the problem is, if you start removing every mole that gives you some symptoms that maybe changes slightly or starts to cause some problems, then you might end up trying to remove all of your moles, which is a not great situation to be in, and can be never ending, because you might get new moles. So I wouldn't recommend kind of removing all moles at the drop of the hat. I would recommend having a low threshold to remove a mole if there are concerns about it. But what we normally tell patients is the things to look out for to seek help if you have those things: bleeding, itching, change in size, change either way, bigger or smaller, change in color, darker or lighter, indistinct edges, halo areas around the side, satellite lesions. There's certain things that we would tell people to look out for. But if you get one of those things, it doesn't necessarily means it's malignant, and it doesn't necessarily mean it needs to be removed. So you don't necessarily have to have every symptomatic mole removed, particularly if it's a cosmetically sensitive area and you kind of like the mole. If you don't like the mole, and if it's not in a very cosmetically sensitive area, and it was just kind of one or two we're talking about, it's probably better to err on the side of caution and to remove it. But if you don't like the mole, and it's in a place where it's not really, you're not going to be too concerned about scar, you're best to err on the side of caution and have it removed. But I don't think you necessarily need to remove them all if there are symptoms. How long after having a lesion removed before I can go into a swimming pool? So, I mean, a lesion covers quite a lot of things in terms of size. So the bottom line is you want to have the wound healed. and we normally hope the wound's healed in a week. So I would say on the side of caution, 2 weeks. The sea is a bit different. If you're going in the sea, you can go in a bit sooner, but a swimming pool, you probably want it properly healed, so there's no exudate or anything like that. So you've got no dressing. You can wear clothes. You can wear a linen white shirt over the top of the scar, and there's no stuff on the shirt. If there's any stuff on the shirt, then I'll be thinking you better not go in the swimming pool. Basically, that's kind of like a rule of thumb. If there's any kind of ooze or if there's any raw surfaces, but if it's completely dry and just a healed scar, which it should be after a week, so I would say 2 weeks to be safe. You can start going in a swimming pool. The other thing to be aware of is you don't want to put too much tension on the wound with a lot of like crazy swimming. So just be aware of that if you are going swimming. But the actual process of getting the wound or the scar immersed in a swimming pool, I would say a week to 2 weeks to be safe. A week to 2 weeks, but 2 weeks to be safe. It might be okay. We normally see you at a week or catch up with you at a week, so we can always discuss it then. But 2 weeks is probably kind of like a safe time scale to give you. Can I have a mole removed and then go on holiday after 2 weeks? You can. I think I had. Yeah, this patient was in the clinic the other day, and I think what I would say to you and what I said to them is you can, if you really want to. If there's a pressing reason you need to have it done now, you can. It'll probably be fine, but there's that word probably. It might not be fine. There might be a bit of wound infection. We might say come in, we'll have a look at it, give you clean, put a new dressing on it, give you some antibiotics, whatever. It's not common to need those things. Usually you don't need anything. But if you do need any like help like that, it's just a bit difficult if you're on holiday. So I would say if it's not a big deal, which it normally isn't in terms of mole removal, there's normally no kind of time-sensitive nature to it. So if you haven't got any pressing need to have it done now, I would say you're probably better off waiting till after your holiday. And I normally say kind of 6 weeks is kind of normal before you want to think about going on holiday and stuff like that. So say if you have to go on holiday, you can, and it'll probably be absolutely fine. But every now and then you get little bits that don't heal up so well, little wounds, might need a little dressing, might need some ointment, some cream, some maybe even some antibiotics, and that's just difficult if you're on holiday. So if you can, I would probably say that's not an ideal situation to go on holiday 2 weeks after your mole removed. Plus the sun, I don't know where you're going, but if you're going somewhere hot, you don't want to get the sun on it. So, I would say, if you ask me, don't have it removed now. And I think this is what I said to the patient. Have your holiday, have a great time, and then come back when it's, when you haven't got a holiday coming up soon. So you can, but I wouldn't recommend it. I think that's the packaged answer. That's the packaged answer, that is. Well, I'm out, as they say in SWAT. Cover me. So I am done. If you do have a question, for goodness sake, what are you waiting for? Get a message out there, type it in the chat, message me on whatever platform this is. Is it YouTube or Facebook or, well, that's it, YouTube and Facebook. And I will do my level best to answer it. Next week's half term. Probably not going to do it half term. It's a rollover. We've got a rollover week, so it'll be the week after next. So if you have any questions, you can call me, you can message me, you can email me, whatever, direct message or comment. You can comment me. Goodness knows there's enough ways to get hold of me. If you click show to the bit. Oh, okay, fine. Sorry, that's okay. Shouldn't have clicked that. That was for test purposes only. So I'm going to check out of here. Hold on a minute. Steady on. Anthony Taylor's got himself in there. What procedure would be appropriate for multiple lipoma, mixed and bunched, large and small? The best thing for lipomas is excision. And often multiple lipomas, particularly if they're close to the skin, the beauty of it is if they're not close to the skin, they're probably not a bother because they're deep and you don't know they're there. The ones that are bothersome are usually the ones that are close to the skin, which means that they're a little bit more easy to remove. So with multiple lipomas, often you can just do a little incision over the lipoma and pop it out. So you can remove multiple lipomas. And I'm not proud of it, but I have removed like 100 lipomas or 200, like a ridiculous number of lipomas off someone once. It's general anesthetic, arms, legs, absolutely littered with scars. I don't think it was a good thing to do. I'm not putting that down as a good thing, but it just shows you can remove a lot. So it's certainly, possible to remove 10 or more lipomas in a session, lots of little stabs. If you don't mind having lots of little stabs all over your arm or your leg or your tummy or wherever they are. But I think the best treatment is, in answer to your question, Anthony, is excision of those lipomas. And you can get large and small ones. Yeah, I mean, obviously larger ones need maybe a slightly bigger cut. And that's the other thing. So I'll probably do it under local anesthetic. That one when I did loads, I did it under general. If you really have got loads and you want to have loads done, you could have a general. It just makes things a little bit more difficult in terms of going to hospital, and still could do it as a day case, but it'll be a GA day case. So you could have it if you. It depends on what we're talking here, Anthony. Depends on what we're talking. But if so, yeah, you could have a G. So the anaesthetic would be in question, local or a general. You could take more under a general, but it's a bit more of a palaver, a bit more costs associated with it because you've got to pay an anaesthetist and you've got to pay a hospital. But obviously you could take more out. So Jackie is here. Jackie's the one. Well done, Jackie. Thank you. Enjoy your evening too. Anthony's back at me. Situated around the tummy and sides, hundreds in this case. I mean, yeah, so I reckon we could remove 10 or more, 10 or so under local. If you're literally talking, I don't think we can move hundreds, but we could remove more under a general, just bang, 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 bang. So yeah, you could remove more in a general, but as I say, it does escalate the price, but it escalates the number of lipomas we can remove. So one for a discussion there, Anthony. Call me, message me. Maybe this is it. We can message you if you want to rap about it. You want to talk about cost of doing such a thing. But yeah, the other thing, Anthony, you've got to be aware of is you will have loads of scars. So it's kind of like you're trading bumps in for scars. Hopefully the scars will fade, but when you have multiple lipomas, you have to put the scars over the lipomas. Sometimes you can get 2 out of 1 scar, but broadly speaking, you have loads of little stab incisions. Try and make them as small as possible, but there'll be loads of them. But yeah, it's a thing. It's a thing doable. And we could certainly explore that if you are interested in such a thing. Thanks, Anthony and Jackie, for a last-minute reprieve on the lack of activity. But yeah, much appreciated. What you got? Probably best to arrange an initial review. Yeah, what we're doing nowadays, Anthony, we're trying to make things easier for patients. I don't know where if you want to see me, or someone at my clinic, what we're doing is we're encouraging people to send us a photo. I appreciate it can be difficult to see lipomas on a photo, but to try and save them an initial. So we try. It's up to you. You can come for an initial consultation if you want. That's fine, but we don't want to kind of say something to an initial consultation that you think, well, forget it then. And then you kind of think, well, that wasn't worth it. That was a waste of time. So we can do quite a lot with photos, and we can give you ideas of prices and stuff. If you're having done a local anaesthetic, we do a see and treat service at the clinic where we do it on the day. But if you're literally having, many tens, should we say? I don't think we could remove hundreds, but many tens. That might be a GA, so we probably would need a consultation in the first instance, and then we could look at the general anesthetic where they put you to sleep. And as I say, it would still be a day case, but it would be kind of like all day. You'd be in hospital all day, as opposed to a local where you're just in for a few hours. But yeah, it's if you're looking for multiple lipoma removal, Anthony, you come to the right place. Should we just say that? Yeah, because multiple lipoma removal is my game. Staiano is my name. So yeah, you're welcome, Anthony. Thank you for participating. To be honest with you, I don't know what I've done without you and Jackie, but thank you for being here. Yeah. Without further ado, that was a good reprieve. That was a last-minute reprieve. I am going to check out and be here week after next. But I think most of these questions I do answer them when people ask the question. I just roll them over for the live Q&A. But I do, if you do have a question, I will try and answer it to you, and then answer it properly here. So yeah, have a good evening, Anthony. Have a good evening, Jackie. Thank you very much for being here and commenting, and give love to everyone else who knows me. Thank you and good night.